OSCE practice 1.
It's administration of inhaled medication. So I enter the room and check for scene safety. I confirm that the room is safe for me to approach, and I provide privacy by closing the door and drawing the curtains. And I do hand washing using 7 steps: palm to palm, right palm over left dorsum, vice versa, fingers interlaced, fingers interlocked, tip of the fingers, thumb, and the wrist, and dry my hand for 30 seconds and approach the patient. Hi Tang.
Hi.
Good evening. My name is Saroja. I'm your nurse for today.
Hi, nice to meet you.
I'm here to give you inhaled medication which is prescribed by your doctor. Is it the right time to proceed?
Oh, yeah, of course, yes.
Okay, thank you. So before I could proceed, just I want to ask you a few questions. So can I know your full name?
Yeah, my name is Jinxian Tang, but you can call me Tang.
Tang, okay. Can I know your date of birth?
Yes, it is 6 of 6, 1952.
1952, okay. Are you allergic to any medication?
Yes, I'm allergic to penicillin.
Penicillin, what kind of allergy you get?
I get rashes all over my body.
Okay, you get rashes. I'll make sure when you're in hospital that we don't administer any medication which contains penicillin. Is that okay?
Of course, thank
Okay,
you.
is it okay if I just come to check your ID band as well?
Of course, here it is.
Okay, so your name is Tang and your date of birth is 6 1952 and your hospital number is 012346 and
Correct,
you're allergic
yeah.
to penicillin and you get rash. So I confirm that I'm with the right patient. Tang, I'm going to administer the medication as I said earlier. So you need to do that in a proper position. I want to make you to sit in a sit-up position. Is it?
Of
Will you be
course,
able
yeah.
to do it, or do you need any help?
No, I think I'm fine.
Okay, so I'll go collect the articles. Meanwhile, if you have any problem, please press the buzzer. I will be here. Is that okay?
Of course,
Are you
thank
comfortable?
Yes, I am.
Okay, thank you. I wash my hand. I do hand washing again, and I collect the articles. I validate the articles. Before that, I'll read the prescription. The patient name is Tang, and the date of birth is 6/6/1952, and the hospital number is 123456, and the medication which I'm supposed to give is Asthalin. It's 200 microgram, 2 puffs. And the doctor's name, the beep number, and GMC number is present. The prescription pharmacy check has done, and I'm supposed to give at 8 o'clock, and I'm supposed to give through. It's supposed to be inhaled medication, so the prescription is valid and it's valid and it's legible. So I will be giving the medication. So I'm taking. Examiner, can you tell me whether the tray is cleaned with soap and water in 24 hours?
It's been cleaned.
Okay, thank you. So I take the tray and I take the inhaler. The inhaler, I'll remove the inhaler and I check the date, and it's the expiry date is in 6/2026. It's intact and in date. So I connect it back and I take the spacer. It's intact and in date. I mean, it's not more than 1 year valid. So I take that as well, and I take 2 alcohol swab, and it's intact and in date. So I keep all the articles and I take to the patient. Tang, I'm back with the medication.
Hi.
So before that, I need to wash my hand and wear apron and the gloves. So once I wear apron and gloves and I approach the patient, and Tang, I'm with the medication. So is it the right time to proceed?
Yes.
Okay, so you're in upright position. Just I want to give you some instruction how to take the medication. Okay, so as I said earlier, it's Asthalin medication I will be giving you. So this will be by taking this medication you might have some side effects, okay, like palpitation, chest pain, and you might have some discomfort. Okay, it's a common one. You might have like dry mouth as well. It's a common side effects.
Sure.
But if you are feeling if you feel you are not feeling well, then you let me know, then I will inform the GP, your doctor. Is that okay?
Sure.
Okay, so I will just instruct you how to give this medication. So you need to sit upright position.
Yes.
So you have to take a deep breath. You exhale out, and I will shake the medication, MDI. I will shake the medication and I will connect it to the spacer. So the spacer one side you have to keep it in your mouth. Okay, you have to seal your lip, and so that the air will not be leaked out. Okay, so when I press the canister, you have to take a deep breath. Okay, and hold
Yes.
it for 2-3 seconds. Hold it for actually 10 seconds. Okay, you have to hold it for 10 seconds and you have to breathe out. Okay, I'll remove the spacer. You have to
Okay.
breathe out using pursed lips.
Okay.
Okay, so if you are unable to hold your breath for 5 seconds, I will go with the other method called multiple breath technique or tidal breath. Okay,
Sure.
so which one you prefer?
I think the
First
the
one.
technique, yeah,
The
that
first,
is good
okay.
for me.
Okay, so for that, so here is the medication. So I'm going to shake it before I could use, and I check that whether the inhaler has any block in that. I confirm that there is no blockage. So I shake it well and I connect it to the spacer, and so I'm going to keep the medication. I'm going to give it to you. You have to hold with your hand. Okay. So
Okay.
you have to close your mouth, and I'll press the canister. Then you have to take deep breath. Okay. Can you do it?
Yes.
Okay. Can you take a deep breath? Hold it for 10 seconds, and I'll remove it. And can you breathe out? Okay. Okay. Thank you. So I have done once. So it's if I have to give you, I have to give you one more puff. For that, I need to wait 30 to 60 seconds. Okay.
Okay.
So can you do it again?
Yes.
Okay. Here, take a deep breath, and I'll press the canister and take a deep breath and hold it for 10 seconds, and I remove it and breathe out. Okay, thank you. And if at all, if I have to give you any other inhaler, then I will be waiting 2 or 3 minutes. Okay, 2 to 3 minutes. Is that okay? So you have taken the medication. By taking aspirin, you might have bacterial infection. Okay, that is also common one, but you need to keep your mouth clean, and you have to brush your teeth, and you need to keep hydrated. Is that okay?
Sure.
So I have finished the procedure, and I'm going to give you the spacer with you, leave the spacer with you. So what you need to do, you have to use only, you should not share with anyone else. Okay, you need to wash the spacer each time when you use. Okay, so you need to shake it each time when you use. Okay,
All right.
each before taking each puff, you have to shake it well.
All right.
Is that okay?
Okay. Of course.
Okay, so are you comfortable?
Yes, I am.
Do you have any concern?
No, I.
Okay, here is the
good.
call bell. If anything, you let me know.
All
So
right.
I'm going to do the recording. I'll come back. Is that okay?
Sure.
So I will take all the equipments. I'll discard whatever I'm supposed to discard, and I wash my hand and I do the recording. I'll come back and I'll give some health education. As I said earlier, that I have given most of the health education. So I'll tell the examiner. Examiner, I have finished the procedure, and my patient is comfortable. I documented all the information as per the NMC guidelines. I discarded the waste as per the hospital policy. Thank you.
Thank you.
8 minutes. This is how many minutes?